how do you ensure that patients do not feel invalidated when you do cognitive restructuring?
Okay, again, you need to have a good case formulation, and if you know that and part of the case formulation is you have to know what the patient's interpersonal vulnerabilities are, and one of the guides to this is we know that borderline patients, for example, do tend to be to feel vulnerable, and so when you are going to do a particular approach with them, you could say, now here's a particular approach, and what do you think of it? Now, using cognitive restructuring is a technique, but the question is, what's going to be the meaning to the patient? So if you say to the patient, what is the evidence that your parents mistreated you as a child, and that's the reason, what is the evidence for that? The patient may very well think, he doesn't believe me. He doesn't realize that he's just like everybody else who's picking on me and trying to say that my thinking is all screwed up. So we know that that's probably an assumption the patient has, that everybody thinks, and it's probably based on reality too, the sense that people have already said that. And so cognitive restructuring is taken as an attack. However, there are a dozen other approaches that one can use rather than explicit cognitive restructuring. So we'd have to, and I could show that if we had.
So who asked that question? So do you have an example of a patient who felt invalidated? So if I could just address that, this therapist was saying that she's sometimes reluctant to do cognitive restructuring for fear the patient will feel invalidated. And so one of the things, and I talk a lot about this in the Core 3 workshop, is you never know in advance what's going to be the most helpful and what's going to be the least helpful. So you say, can you tell me, what happened to you as a kid that makes you think your parents mistreated you? And then the patient gets very upset, and you say, what was just going through your mind? And the patient says, well, you're just like everybody else. I mean, you're not even believing me. And then you say, oh, it's so good you told me that. And I'm sorry that I gave you that impression. I think that was not obviously a helpful question for me to ask. What do you think would be more helpful for us to do right now? So you might even ask the patient. But I think that if you are not accustomed to doing cognitive restructuring, then it's really important for you to do a behavioral experiments and find out whether patients find it helpful or not helpful or someplace in between.